Hello, my name is Allison Park. I'll be going over today what clinical guidelines are. This webinar was created with myself and Lindsay Stanowski. I would review from Dr. Sharon Park. In this webinar, these are the objectives that we will go through today. How clinical guidelines are used, who develops clinical guidelines, how they are structured, how to find one, how to recognize a credible guideline, how to search for information inside the guidelines, and practice question using the GOLD guideline. First, let's start with a definition. The National Academy of Medicine defines a clinical guideline as statements that include recommendations intended to optimize patient care that are informed by a systematic review of evidence and an assessment of the benefits and harms of alternative care options. To continue, additionally, clinical guidelines are a tertiary resource, a summary of information from primary literature. Guidelines have two parts. 1. A systematic review of the evidence on a clinical question that centers on the strengths of the evidence. 2. A set of recommendations that are based off that evidence and value judgments about the efficacy and safety of alternative treatments, also discussing how patients should be managed. So who actually makes these guidelines? A guideline committee made up of specialists is formed to cover all the aspects about the clinical condition in question. These committee members must disclose any conflicts of interest that they have. The committee is usually led by a member of the medical association related to the specific medical condition for which the guidelines are being developed for. The committee collects information from different sources and assesses the information using predetermined criteria. Various assessments and opinions of committee members are taken into consideration and recommendations are consensus-based. So how do you use a clinical guideline? So the recommendations from the clinical guidelines are not laws, but rather suggestions that are based on evidence to support and guide clinical decisions. Individual patients should still be treated differently based on patient-specific characteristics. Other uses also include health plans and administrators who use them to measure quality and determine payment for care. Guidelines can also be translated into performance measures to assess care at a given facility. Now let's go over the structures of a guideline. Guidelines begin with an introduction, an overview of the disease state, covering the definitions of the terminology used, epidemiology, risk factors, pathophysiology, and more. Next, they cover diagnosis, symptoms, assessment, clarification of severity, differential diagnosis. And then there's treatment recommendations. These are evidence-based, pharmacological, and non-pharmacological options that are covered. And they also cover the goals of therapy. Now, how to actually find guidelines. Guidelines can be found at websites of sponsoring organizations, such as major medical organizations and clinical specialty societies. They can also be found by entering into Google clinical practice guidelines or other search engines. They can also be found by setting practice guideline as a limit term for a type of article in secondary resources such as PubMed or Google Scholar. They can also be found by searching through specialties in Dynamed. So let's go through a quick example. Finding the GOLD 2019 guidelines. So the first way is to find the developing organization, the Global Initiative for Chronic Obstructive Lung Disease, who develops them. Another way is by entering clinical practice guidelines into a search engine such as Google. Yet another way is by setting practice guideline as a limit term for a type of article in PubMed. As you can see right here under Customize for article types, in the green box is Practice Guidelines. So by searching COPD guidelines and limiting it to Practice Guidelines, this will come up as one of the first. Another way to find these guidelines is to go to Dynamed database. From their website, under Specialties, there's Pulmonary Medicine, right here on the right. Step 2. Expand COPD section and select COPD. After that, expand the Guidelines and Resources section and select the guidelines right here in the green box. Step 4. Click International Guidelines and find GOLD 2019. And this link will take you straight to it. Here are some steps for recognizing credible guidelines. Credible clinical guidelines should be based on systematic review of existing evidence. They should be developed by a knowledgeable multidisciplinary panel of experts, consider important patient subgroups, be based on an explicit and transparent process, minimizing biases and conflicts of interest, and they should disclose this. Provide clear explanations of alternative treatments and health outcomes, providing ratings on quality of evidence and strength of recommendation. Clinical guidelines should be updated and revised when important new evidence warrants changes, and clinical guidelines should be in agreement with other guidelines. Now let's move on to finding information within the guidelines. This slide is a quick overview going over how to find information. In the next few slides, we'll cover it in more detail. As an example, here's a question. What are the risk factors for COPD? And we can answer this using the GOLD 2019 guidelines. Step 1. Search in the table of contents. Step 2. Under the table of contents, look under Chapter 1, Definition and Overview, Factors that Influence Disease Progression and Development, page 9. So now let's move on to page 9. And we can see that from page 9 to 13, there's information about COPD risk factors such as genetic factors, age and sex, lung growth, development, exposure to particles, etc. Here's an example search question. BT is a 55-year-old male who was recently diagnosed with COPD. He has never been hospitalized for a COPD exacerbation. He has not started any medications for his COPD. BT's post-bronchodilator spirometry score is 65 FEV1. He has a MMRC grade 2 and CAT assessment of 18. What is an appropriate initial pharmacological treatment for BT? Now, how do we actually go about searching for this? Here are the 3 steps. 1. Classify the patient's disease. 2. Determine initial treatment options. 3. Determine medication regimen options. Now let's go over this in more detail. Starting with step 1, classifying the patient's disease. From the table of contents, you can find under Chapter 2, Diagnosis and Initial Assessment, the Assessment Combined COPD Assessment under page 34. From there, on page 34, you can find the refined ABCD assessment tool. And here are BT's diagnostic criteria from previous slides. He has had no hospitalizations, his FEV1 score is 65, MMRC grade 2, and CAT of 18. So this would put him under grade of GOLD 2 based on his FEV1, having had 0 hospitalizations, and an MMRC of 2, and a CAT score greater than 10. This would put patient BT under B category. Now, based on his category, we can determine his initial treatment options. Going back to the table of contents, under Chapter 4, Management of Stable COPD, looking under Treatment of Stable COPD, Pharmacological Treatments, Algorithms for the Assessment, Initiation, and Follow-up Management of Pharmacological Treatment. This can all be found under page 91. Flipping over to page 91, we can find a table guiding the initial pharmacological treatment options. Based on BT's diagnostic criteria, we found under step 1 that his grade was category B, based on having 0 past exacerbations not leading to hospitalization, MMRC score of 2, and a CAT score of 18, which is greater than 10, placing patient BT under Group B. Options for patients under Group B is a long-acting bronchodilator, such as a LABA or a LAMA. Now, let's actually determine the medication options under Step 3. Going back to Table of Contents, looking under Chapter 3, Evidence Supporting Prevention and Maintenance Therapy. Let's go into the pharmacological therapy for stable COPD, bronchodilators and antimuscarinic drugs, found under page 49 to 51. From this chart, found under that page, we can determine the medication options. So as we said earlier, for category B, LABAs or LAMAs are appropriate options. Now to wrap up, let's have a quick overview of the answer. Per the ABCD group assessment chart, patient BT is classified under Group B, which was found under page 35. Initial treatment options recommended for patients in Group B would be a long-acting bronchodilator, such as a LABA or LAMA, and this was found under page 92. These medication options found under page 50, a LABA and LAMA, are listed below. To summarize, guidelines are a set of recommendations based off of evidence to inform and advise healthcare professionals on making clinical decisions. Guidelines include information about an overview of the disease, diagnosis of the disease, and recommendations for treatment. Guidelines can be found through the medical organization's websites, using a search engine such as Google, or secondary database such as PubMed or Google Scholar. You should be mindful of authors, biases, and evidence ratings when deciding if a guideline is credible. In order to search inside of a guideline, you should always start with the table of contents. And here are our references.